It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone. Welcome again to another live round of Katz's Corner here on WABC Radio in New York. I'm your host, Dr. Aaron Katz, and we are live at 1-800-848-WABC. That's right, 1-800-848-9222. Dr. Cheetz is away. She's down in the sunny Bahamas learning more haifu. I don't know. How much more haifu can you learn? But, listen, you can go down to the Bahamas at this time of year. It's supposed to be spring, but it still seems rather chilly. So I'm in the studio. I have a lovely guest with me this morning. I'm going to get to her in just a moment. I hope everyone is feeling well. I want to again remind everyone we are running a men's health seminar at the Garden City Hotel. It'll be our second seminar at the Garden City. Last year was phenomenal, and this year will be terrific, and we hope to see all of you and your loved ones there. Spread the word. It's Father's Day weekend. It's the Saturday of Father's Day weekend. It's June 15th. That's menshealthseminar.com, menshealthseminar.com. You have to register. We have a number of people, actually a record number, that have already signed up here in March, and I know that, June's going to be here soon, so menshealthseminar.com. In fact, my guest this morning will be one of the speakers talking about integrative medicine and an integrative urology at the seminar. That is Jillian Capodici. It was a very good weekend. Well, it was a good week, up and down week, but we ran a program for urology for the primary care physicians out at Winthrop, and terrific meeting. I was very proud of all of the faculty that gave terrific lectures. Winthrop faculty, really phenomenal guys there. I'm so impressed with all of them. Just teaching primary care doctors about how to evaluate and diagnose and manage men and women that come to their practice with urinary difficulties, elevated PSAs, sexual dysfunction. We had a talk from Dr. Fish talking about hypogonadism and testosterone replacement. We had great lectures from Dr. Lumerman, Dr. Jamal, Dr. Toby Handler about female urology. She gave a great lecture. Dr. Cheetham gave a lecture on PSA, and I talked about prostate cancer. A terrific meeting for doctors, just trying to educate your primary care doctors about, what's the latest, the greatest, allopathically as well as integratively. And so that was a terrific meeting. And also we had a pediatric fundraising event. This is an annual event there for the people that take care of cancer patients. And God, I know this all too well, having my own son gone through cancer, the child life people. And Dr. Warren Rosenfeld, who is the chair of pediatrics at Winthrop, ran this fundraising event. I would say there's probably over 400 people there. A terrific event, and he also made mention that pediatric urology has received the gold star by U.S. News and World Report, that it is a top-ranked pediatric urology program at Winthrop, the part of the Children's Hospital at Winthrop. So, again, I was just very, very proud of all of that went on this week. And on a final note, I was very proud of my own son, Alex, and many of you do know his battles, and that he, had been diagnosed with leukemia about 5 years ago, almost 5 years ago to the day, and, he had to have a bone marrow transplant. But this week, having missed almost 90% of high school, really amazingly, he was able to stay on track, and this week we found out that he got into a number of colleges, such an inspiration to me and to everyone that knows him and is touched by Alex. Colleges like University of Miami, Delaware, Connecticut. And then yesterday I came home and he was smiling and he said, "Dad, I got another letter." And he said that he was accepted to Bucknell. So I just want to congratulate him on that. And he continues to inspire me every day. Just shows you what you can do when you put everything behind it. Incredible. So I welcome all of you this morning on this wonderful Sunday. I hope you have a great week, a religious week coming up with, and I'm sure Religion on the Line will talk about, Passover and Easter, Good Friday. A wonderful week, and I wish you all well and good health and wonderful times with your family. That's really what that's what I find with these holidays. It's really, to me, it's the traditions, but it's also just being around the table, whether or not you're in synagogue or church, and just being with family. Our guest this morning is Jillian Capodici, and I've known Jillian for many years. Extremely bright woman. She actually came to me at Columbia, I don't know how many years ago, and worked in the laboratory when I was working at Columbia on integrative urology, doing basic science work with a compound called Zyflamend. And she was actually the first person to publish, I think, in the area of urology on Zyflamend, an herbal compound, and then helped me run integrative urology and holistic urology at Columbia. She then became an acupuncturist, and she's treated so many men and women integratively, holistically. And now, I'm very proud of her. She is the director for the Center for Integrative and Holistic Medicine at Columbia. Her email is jc2346, jc2346 at columbia.edu. I'll announce that again. Good morning, Jillian. How are you?
Good morning. I'm great. Thanks so much for having me.
Yeah, you're great, and it's wonderful to see you. So tell us, because I know that you're also in, the academic world where you go around the country and you speak to other doctors at academic centers and you go to these conferences. And I'm often asked too, let's talk about the prostate, because that's what most of our listeners are interested in. And if you have a question, it's 1-800-848-9222. What do you think now is there evidence now that we can prevent prostate cancer holistically? What do you think?
From an academic standpoint, I think...
Well, academic, or, somebody comes in and they say, look, I'm worried, I have prostate cancer, or I may be at risk. What do I do? What do you advise them?
I think that there is some evidence, and I think a lot of it lies in very simple diet and lifestyle things that people can do early on to just lead a healthy, balanced, and beautiful life. That's really the whole point. Ultimately, you want to try to prevent any disease, but with prostate cancer in particular, I think exercise is really important. I think nutrition, having less red meat, more vegetables, things like that, limiting alcohol, smoking, etc. Those are key indicators that could help reduce a man's risk.
And what is the most common complaint that you see that patients come to you? You're an integrative, holistic provider. What for men? What are they most likely to see you for?
For men, it's going to either be a symptom, whether it's erectile dysfunction or pelvic pain. But a lot of people just don't know where to start. They're like, I want to lead a healthy lifestyle. What does that mean? And I think that's the top question. I started taking all these supplements. Are they good for me or are they useless? So I think that that's one of the things that we do best, is we really try to help guide someone and have them take control of their own life, and also just educate them so that they can be empowered to make healthy decisions.
You mentioned erectile dysfunction. So ED, typically, and we did have a talk this week at our CME program about how to manage ED, and actually last week, if you didn't tune in, and you can always get the podcast at wabcradio.com, we had Scott Schuback on, who's the director of cardiovascular surgery at Winthrop, talking about cardiovascular disease and how if men starting to have some problems with erections, it may be an indication something's going on with their heart. How do you evaluate or do you treat men holistically that are starting to have some troubles with ED? Because you're not an MD, so you can't really prescribe Viagra. Is there something beyond Viagra now that you think is helpful?
There are some herbal things, and it really depends on the cause. So in working in an integrative way, obviously I work with a traditional urologist who specializes in sexual function, Peter Stahl. But that being said, there are some herbal things that we can use that have some clinical data behind them. And also, depending on the cause, maybe we do some mind-body things, such as mindfulness-based stress reduction, things like acupuncture that can help men with different other types of erectile dysfunction.
So acupuncture, you think is how does acupuncture work for erectile dysfunction? Does it give blood flow to the penis?
Well, we don't know. We're going to be studying it in a clinical trial.
Really?
But the way that we think it works for a specific type of like adrenaline-mediated erectile dysfunction means that when a man gets into a situation and he can't perform, he has this rush of adrenaline coming from his adrenal glands, and that ultimately keeps happening every time. And one thing that we know that acupuncture does is it calms the nervous system down. So in that sense, doing that and teaching someone some simple meditation-type techniques can actually help improve a lot of men.
Wow. So you're saying a guy has performance anxiety, and there's this rush of hormones that get released, and by you taking acupuncture, you can train your body to calm that down and to prevent that release?
That's what we think, and I've treated a lot of men in that way.
Huh. And is there any herbal things that you recommend for men with ED?
Herbal things, it depends. I know that you've had some mixed compounds on the show before, but some of the things that do have some clinical data are a couple of amino acids. One of them is L-arginine. And the other herb that's used a lot is something called yohimbe or yohimbine, and that actually was used before the age of Viagra. That's what people would prescribe. So there is some good clinical data, and again, it has to be used with caution, and you have to talk with the patient about potential side effects and everything. But there are some options, and also it could be a good option for patients with regard to cost, because you know that all those PDE5s are quite expensive. They're ultimately cost the patient like $20 to $30 a pill.
Yeah, and it doesn't really fix the problem. It's more of a Band-Aid type of a thing, isn't it? What about women? We had a great talk with Toby Handler, who's one of our urologists out at Winthrop. She gave a great talk about, female overactive bladder and incontinence. Is there any role for holistic or integrative medicine in this area?
I think there's definitely
because women are so open to this.
Yeah.
They really are much more open than men to seeking the advice of a holistic practitioner like yourself, especially one that has the credentials that you have. Have you found that to be helpful?
I think there's definitely a role, and again, it does depend on the pathology in general. But with regard to overactive bladder, we know that some stress reduction techniques can also help with frequency, urgency that women might experience.
And that would be what, acupuncture you would use?
You could use acupuncture. You could use meditation or relaxation. You could use timed voiding. You could use all those sorts of things and kind of look at it in a comprehensive way to see what non-invasive type things that you could use.
Yeah. You gave me acupuncture once, I guess, I don't know how many years ago, maybe 6 or 7. I remember I had a shoulder pain, I think, and I was about to take a flight. And you said, no, come in the room, in the exam room, and I'll give you acupuncture. And I remember having this euphoric feeling. And, of course, I went to sleep because that's what I do. You just touch me, and I'm like, okay, I'm out. But have you found that, that it's not really painful? People think, oh, you have acupuncture. And of course, you're not going to put, these needles in the penis for guys that have ED.
No,
right?
No.
Right. But it's certain places that you put, I guess it's a Chinese map or something like that,
yes.
And you follow that map. But I remember just almost like a high, and like a buzz. And then the next thing I knew, I was out, I woke up, and I felt completely pain-free. After one treatment, after one treatment. How many do you see that a lot?
Usually yes. I mean, usually the thing that people know that acupuncture is for, which is the insertion of these tiny little needles in the system of meridians, right? Most people have heard of it for pain. So it does treat pain relatively quickly, 1 to maybe 3 or 4 visits. It doesn't take like 50 visits or something.
Yeah.
In Chinese medicine, we like to say that response that you had was like a good qi response, or qi means energy, right? But from a medical or physiologic perspective, we know that acupuncture releases endorphins. So probably your listeners have heard of something called runner's high. So when you exercise a lot, you release endorphins, and that helps to help your body heal. It makes you feel good.
Yeah.
And that's one of the things that acupuncture does.
Yeah, I feel that, I was telling you before that I do a lot of yoga now, this Bikram yoga, and I feel that too. Like during the class, after the first couple of poses, I'm starting to get that endorphin rush and that feeling of calmness and in going into a different place in my mind and body. And after I finish, it's an hour and a half class. It's very difficult to get through it, but when you do get through it and you're sweating so much, it's such a release of all these toxins. And I don't know. It just gives me a burst of energy.
Yeah.
I incorporated it into my life over the last few years, and it's been so helpful.
I agree.
So
there's been studies now that have shown that the
Oh,
benefit
really?
of that, and both like endorphin release, whether it's mediated by exercise or other healthy habits.
Yeah.
There are some other hormones that are released called oxytocin, which make you feel good, and those are really important and those are critical versus things like stressful hormones that are released like cortisol or adrenaline.
I wonder what it does to your testosterone level, when you start to have these, when you're a runner and you get this, is that affecting your serum T level? Well, anyway, this is Dr. Katz, and my guest this morning is a doctor, well, not doctor, but she should be a doctor because she's so knowledgeable. Jillian Capodici, she runs the Center for Integrative Urology and Holistic Medicine at Columbia University, and thanks so much for coming in, Jillian. If you'd like to reach her, she's got an email. It's jc2346@columbia.edu. We'll take your phone calls now at 7:20. Wow, this half hour goes by so quick. But let's take some phone calls. We got one from Mike up in Fairfield about some prostate procedure. Good morning, Mike.
Good morning. Thanks for taking the call.
Sure. How are you?
Very well, thank you. I have an enlarged prostate. On Tuesday, I'm scheduled for a green light laser. The size of my prostate is about 30 grams.
30?
Yes.
30? Well, that's not a big prostate. I mean, unless you're 5 years old. I mean, you don't sound like you're 5 years old. But if you're not 5 years old, I mean, 30 is normal size. How old are you?
68.
It's a small prostate.
But I'm making bladder stones. I had a cysto in November with about 20 stones.
Oh, yeah?
And then I had one maybe 2 weeks ago with over 100 stones.
Wow.
I was tested for uric acid, and it was not, my uric acid levels were normal.
Well, that's...
I have diverticulum on the prostate, the wall getting a liquid.
So it could be, Mike, that you've got this prostate condition that's not overly a big prostate, but that prostate tissue is just sitting at the neck or the funnel of your bladder. So it sounds like a green light's going to be the right way for you to go to open your neck. And
my question is, not to interrupt you, but
no, go ahead.
My question is
people do that all the time. Yeah.
I understand the hospital I'm going to doesn't have that new laser. That's the 180 laser, right?
Right, the XPS. Yeah, we have that at Winthrop. Well, that's the new one.
Does that make a big difference, or?
You know what? In your particular case, I would say no. The newer fiber is much more powerful, and you don't have to go through all the fibers. If you're dealing with a 180 or 200 gram prostate, with a 30 gram prostate, does it make a difference? I would say probably not. I think what's more important, Mike, is the doctor. Has he done a lot, and you feel comfortable with him? That's key.
Okay, and I was, I originally opted for the laser.
Right.
I've already had bladder cancer twice.
Oh.
So I switched to the TERP, and then I went back to the laser because I spoke with someone else, got another opinion that my physician told me that the laser vaporizes the tissue, so they can't get any tissue samples for to test the process. Though my PSA is 0.6, so
now you're fine. I mean, with the PSA of 0.6, there was a recent article in Journal of Urology that we reviewed this week or 2 weeks ago back in Journal Club, showing that you don't need to take tissue for a low PSA like that. You're not going to miss significant cancer, so you don't need a TERP. A green light's fine. If your doctor's done a lot, you don't need the high-powered laser. If you feel comfortable, it's the right thing to do because you're making stones. I would have it done. I mean, it sounds like you're going to be having it done anyway, right?
I'm having it on Tuesday, but I've been taking that potassium citrate. But I don't know if that's actually helped anything now to.
Yeah, that'll help to reduce further stone formation. It helps to change the pH balance of your urine. So that'll be helpful. I would do that for patients with uric acid, kidney, or bladder stones. That's fine. But, if you've got residual stones or a situation like that's blocking your bladder, it sounds like you probably need the green light, Mike.
The largest stone is, he told me, was about the size of a match head. Will that be able to be taken out transurethral?
Oh, yeah, absolutely. Match head, absolutely. You could probably pass it on your own. But once she opens you up with the green light, you'll be fine.
Well, thank you so much for giving me some reassurance of what I'm doing the right thing.
Yeah, sure thing, Mike. If you want, give me a call next weekend. Let me know how you're doing, okay? Thanks for your call.
Thank you.
Yeah,
Bye-bye.
I mean, Jillian, here's a case where, people say, I want to see Dr. Katz. He's a holistic doctor. And you're running this integrative urology program. Some people like this gentleman need a procedure, right? I mean, not everyone can be treated with herbs alone, and not everyone should be treated, allopathically with surgery. But if you have an appendicitis, you're not going to treat that with herbs.
Of course not. That's the whole idea of integrative. That's why we work together.
Exactly, And do you see, because you go around the country, I mean, do you see this more and more, that it's becoming accepted by the top medical centers in the country, And let me ask you honestly, do you think that they are accepting it because they believe in it, or are they accepting it because they think it's a good marketing tool? And I don't mean to be, I don't know what the word is, negative about this thing, but what do you think?
Right. That's a great question. I think it's both.
Mm-hmm.
There are definitely some people out there that are passionate, that are doctors or complementary medicine practitioners that are passionate about their field and have helped to advance it. But there's probably some reactionariness, and just people using it as marketing as well. I would hope that it would change over to the former. So,
I mean, what's going to help it change is going to be more scientific studies that are done unbiased, level 1 evidence, which means randomized, double-blind, placebo-controlled trials. And the government is going to have to fund that, because who's going to fund it? I mean, companies, these nutritional companies, they don't have that kind of money. I mean, these clinical trials, they take a lot of money, right? So, you've developed a lot of clinical trials. You know that they can cost. So the NIH is going to have to give to this Center for Complementary and Alternative Medicine more money so that we can really research this and find the true value. Otherwise, it's not going to really change.
Yeah, hopefully they will. I mean, a lot of companies are looking to do studies on their own products, and they should, because that's the gold standard. So.
Yeah, but the problem is if the companies do these studies on their own, then they're considered biased.
Yeah, but you know what? I think that view is changing a little bit just because there is so much less funding. So, you always have to mention it. But if it's well designed, that's what people are looking at now.
Well, I guess you're right, because, the pharma companies, I mean, Pfizer, GlaxoSmithKline, they have a new drug. They're going to fund it.
That's right.
So, people say, oh, well, they funded it. It's somewhat biased. And, even though it's farmed out, let's say, to investigators at academic centers, it may have an inherent bias. And a lot of studies that are done that have a negative result may not be published, and I wonder how many of those go on. But I'm glad to see that more academic centers are taking this on. Do you think that over the last, let's say, 10 years or 20 years, that you're seeing more of this integration and more acceptance now?
I think we are starting to see it, but it is still slow. So
it is, huh? Yeah. Well, I guess it doesn't change much. I know that Norm in Brooklyn has been waiting, so let's get to him. We got a few minutes left. Good morning, Norm.
Hi, good morning. Good morning, doctor. I'm a little nervous. First time I'm on the line.
You are alive. Don't be nervous, but you got about 2 minutes, so go. What's your question, sir?
So here's my question. Whenever I see my urologist, and one of the first things he does, he takes the urine samples, there's always microscopic traces of blood in my urine.
Yeah.
Always.
Okay.
And he says my PSA is always good. My prostate slightly enlarged. He just put me on Flomax. But I'm just curious about that with microscope. He says, you don't see any blood in your urine when you urinate? I said, no. But there's always microscopic traces.
Okay, so what you do need, you need an evaluation with three things, okay? One is you should have something called a urine cytology, just to check to make sure you don't have cancer cells in your urine. Have you had that?
Is that where you urinate in a big like jar for the weekend and stuff like that?
No, that's a 24-hour urine collection. That's not what you want. That's just
years ago. Yeah.
No,
sure.
you need a urine cytology. You need him to look inside your bladder. Has he done that?
He has not looked in my bladder. No.
Okay, you need that. Okay, Norm. So you need a cytology that begins with a C. You need a cystoscopy that begins with a C, and then you need a sonogram that begins with an S, a renal sonogram, just to make sure that there's nothing going up in the kidney. Do you have a stone? Do you have a tumor?
Right.
Listen, are you a smoker? You have a smoking history?
I mean, I stopped smoking like 12, 13 years ago.
I don't care. You have a smoking history.
Okay.
Smoking is the number one. I'm not saying you have a bladder cancer or a bladder polyp, but if you look at everyone in this country that does have a bladder cancer or bladder polyp, they have about a 95% chance of having a smoking history. You need a cytology, a cystoscopy, and a renal ultrasound, okay? And then you get back to us, okay? There's persistent blood in the urine. I mean, you've seen a urologist and he hasn't done that? Come on.
He did it years ago. He said my sonograms that he takes, he says everything is fine in the sonogram.
Sonogram of what? Of what?
Of my bladder.
Yeah, and what about your kidney? Where's that sonogram? Get back to me, Norm, okay?
You got it.
Tell him Dr. Katz, this is what he recommended. Anyway, Jillian, I want to thank you so much. You're a terrific guest.